So I had this patient, right? And he had all this, what do you call it, head and neck pain going on, all that stuff. But funny thing, head was moving just fine. Neck was moving fine. Side bending, rotation, flexion, extension, all that. Really cool. No problems there. However, the rib cage, that thing right there, and especially the front of the rib cage was not fine. It was all over the place. It was doing this, some funny forward and back motions. The thing about cartilage is it can move if you put light pressure on it for a long time, or it can move if you put a lot of pressure a few times. This person happened to be a boxer, so it was probably the second thing, a lot of pressure and quite a few times, in fact. Ribs are interesting. They have an interesting relationship with their vertebra. This is that vertebra-rib relationship on a cross-sectional view. We're looking at it from the top down here. Ribs go all the way around, if that's not obvious to everyone, but they go from front sternum part all the way back to where they connect with the vertebra at the TVP, this little arm right there. And when you press on a rib, it's very much like pressing on a vertebra. So if you were to push on the sternum or that cartilaginous bar there, that force is transferred all the way around to that vertebrae. And it's just as if you're pushing straight back on that TVP, that transverse process of the vertebrae. And this can cause it to spin. Vertical axis, that kind of thing. Causes a spin, what you would call a, in this case, right rotation, because now the vertebra is facing that way. It's not a big deal, don't worry about that. But it twists the vertebrae all up. Now, this can happen at multiple points. Certainly can happen at the lower points very easily. But there's something special that happens with boxers or fighters in general in the upper rib area. When they get hit here, they have their head in a certain position. They have their head forward and a bit down. This is a very good thing because it prevents you from getting hit in the neck. It's very bad to get hit in the neck. That's a fight ender right there. So you must keep your hands up and your head forward and down. Let me repeat that. You must keep your hands up and your head forwards and down. But that being said, it changes the shape of the spine here. This comes forward, and so this must come into a bit of a flexion. So looking at that relationship, these are the rib heads here, and these are the vertebral bodies from the front here. When you push down, when you squash it essentially, you also squash the rib heads. They are connected to the vertebral bodies through ligaments and as well to the discs. Many different connection points, but connection points nonetheless. And so when you push down, like so, when you push down vertebral body to rib head, it actually pinches the rib head just slightly. This is fine until, of course, you impact it. Because when you hit it, it's that much more pressure exerted on that vertebrae because this relationship, this connection point here, is very, very strong. It is held by pressure. And so when we torque up, when we put funny spins and turns through the ribs to the vertebrae, it changes the way that vertebra works. It locks out the vertebrae. It fixes them from motion. So we stop the movement here by stopping movements here. When this all stops moving, those upper thoracic vertebrae, the muscles that span between the head and the neck and those upper thoracic, which there are quite a few, they stop moving as well. We fix them. We stop them from moving entirely. So to move that head, normally with any kind of full range of motion, we actually strain these tissues. So we put a lot of force, a lot of extra force through them, meaning that it hurts in the head and neck area, even though this right here is the problem. So in this case, to get rid of that head and neck pain, we've got to move those ribs to a normal spot. We've then got to get those thoracic vertebrae working again. We've got to get the neck muscles softened up. And then most importantly, we've got to stop getting hit in the head so much. Just a suggestion in general.